Hello everyone. Today our health seminar is going to be all about posture. So get ready to posture up and learn about how important posture is for our overall health. I always like to start my presentations with some basic definitions to understand fully what we will be discussing. So what is posture? Posture is the position of a person's body when standing or sitting. Sitting and standing with proper postural alignment will allow one to work more efficiently with less fatigue and strain on your body's ligaments and muscles. The first step to good posture is just being aware. Being aware of your posture, having friendly reminders, is a great way to maintain a correct posture. Being aware of good posture is the first step to breaking old, poor postural habits and reducing stress and strain on your spine. Maintaining a good posture is vital not only when exercising, but also as we go about our days. Your spine is strong and stable when you practice healthy posture. When you slouch or stoop, your muscles and ligaments strain to keep you balanced, which can lead to back pain, headaches, and other problems. Here we have an image of normal curves of the spine. As you can see, the top part of our spine is called the cervical. The middle is the thoracic, and the bottom is the lumbar. Next, I want to talk about spine curvature disorders. On the left, you'll see an image of scoliosis. In the middle, kyphosis. And over to the right, lordosis. I'll explain these on the next slide. Lordosis, also called swayback. The spine of a person with lordosis curves significantly inward at the lower back. Kyphosis is characterized by an abnormally rounded upper back, more than 50 degrees of curvature. Scoliosis. A person with scoliosis has a sideways curve to their spine. The curve is often S or C-shaped. So what exactly is normal posture? Well, on an individual basis, there really isn't anything you could really call normal posture. Because we are all different shapes and sizes, therefore our alignments are all unique as well. But there is such thing as good posture. Okay, then what is good posture? Good posture involves training your body to stand, walk, sit, and lie in positions where the least strain is placed on supporting muscles and ligaments during movement or weight-bearing activities. I've used the term training your body for good posture a few times. As you know, it takes practice, and over time, with these reminders and corrections, this will come more naturally to you, and your posture will improve and then turn into good posture. There are so many benefits to having good posture, but here are a few. Good posture helps you stay balanced and decreases chances for a fall. Falls are the #1 cause of injury among seniors, leading often to broken bones and other injuries related. When you're being more mindful of your posture, you have better balance and a less risk of falling. Good posture can also prevent osteoporosis. Because your back and ligaments have to work overtime when you have poor posture, over time, these overworked muscles can lead to degeneration in the spine and serious conditions like osteoporosis and osteoarthritis. Also, good posture can lower the risk of heart attack and stroke. Older adults often develop hypertension when their blood isn't flowing properly throughout their bodies. This also puts them at greater risk for stroke, heart attack, and conditions like obesity and diabetes. So, for a proper blood flow, it is important to maintain a good postural habit. Some more benefits of good posture include lifting spirits and decreasing feelings of depression. Having proper posture improves your circulation, which better oxygenates your body and leads to a positive mood and perception. Studies have even shown that seniors who stand and sit upright have more energy and are more confident throughout life. Also, good posture enhances cognitive functioning. Even though it's not scientifically proven that proper posture can delay the onset of dementia, a properly aligned spine can aid in communication between neurotransmitters and the brain, allowing for better memory recall. Lastly, it improves blood flow and helps with digestive issues. Sitting up straight while you eat can aid in digestion, as your organs are not being compressed by slouching. Let's talk about a few negative effects of poor posture. One being decreased efficacy of the muscular system as more muscles are under tension and some tissues absorb an abnormal load. In other words, some muscles and some tissues have to overcompensate for others with poor posture. An increased load can cause pain and premature degenerative changes, also known as wear and tear. Increased uneven muscle activity can lead to fatigue, decreased circulation, and accumulation of metabolites, which can cause pain. Shortening and lengthening of soft tissues is abnormal movement patterns. Let's talk about correcting posture through exercise. It is so important to always work on improving your posture. It could be something that you work on throughout the day, throughout the week, and over time, as I mentioned before, it will come natural to you and your muscles will be trained to be correct alignment for good posture. Let's talk about being sedentary. Being sedentary for long periods of time is not good at all for posture. Simply getting up and moving around every so often throughout the day, maybe between TV shows, during commercials, often allows your muscles to stretch out and stay limber. Also, invest some time in learning about some exercises that can help you improve your posture. And there's a few we'll go over today. Over time, the habit of less activity in general creates muscle imbalance. If we quit using our muscles, this will result in muscle atrophy. We need to maintain muscle structure to support our bones and alignment. Performing posture exercises daily helps the body move in ways it would not otherwise move, strengthening the body's ability to move in balance. Now back to muscle atrophy. This is something that we talk about very often here at the Wellness Center. We encourage each and every one to optimize the opportunity to get involved in an exercise program, whether it be an individual-based or group-based exercise routine. We incorporate all kinds of exercises at all different levels to reduce muscle atrophy and improve overall joint health, let's talk about good sitting posture, in case some of y'all are sitting down watching this or listening to this, or if you're sitting down somewhere waiting for a long period of time. Start with this basic reminder: shoulders up, back, and down. Now, we often utilize this reminder down here in the Wellness Center and in classes. So let's do this together if you are sitting. If you're not sitting, you can also do this standing up. Start by sitting up tall in your chair. Feet are flat on the floor. Lift your ribs. Bring your shoulders up, back, and down. This is a great reset for your posture. So try that and let's see how long you can hold this posture. Next, place your spine in a neutral position by tilting your hips forward and backward until you find a comfortable, neutral spine. Then, situate the middle of the back, including the ribs, until a comfortable position is found. Finally, bring your chin forward and back, making sure your head feels balanced. And let's see how long you can maintain this posture. As you can see, this middle figure with the check mark is an example of a good sitting posture. Spine is nice and neutral. The shoulders, the ears, and the hips are all in a straight line. The back isn't curved too far one way or the other. How about a good standing posture? Standing with your feet shoulder width apart, knees are soft, meaning a slight bend in the knee. Arms are held loosely by your side. Draw attention to your pelvis. Tilt your pelvis forward and back until a comfortable position is reached. Now arch your back and round your back until a middle ground is reached and you feel comfortable. Now bring your chin forward and back until a happy medium is reached. So as you can see, to find a nice, neutral, happy medium, you got to play around with these exercises for a little bit. Good posture is a product of good body awareness and good habits. The structure and function of the body provides the potential for attaining and maintaining good posture. I hope that with these insights, you become more aware of and are able to make postural corrections throughout the day and on a daily basis. Try it out and see if you notice a difference in energy levels and how you feel all around. I'm going to demonstrate through these slides a few exercises to help your posture. First exercise is the bent elbow shoulder raise. So sitting or standing with arms at your sides, maintain a neutral spine. Breathe in as you raise your elbows to shoulder height as you bring your shoulder blades together. Exhale as you bring your elbows down. Repeat about 10 times. Do about 3 sets if you're up for it. Next slide will show you a picture of this exercise. As you can see here, she is using dumbbells for this exercise. That is not necessary. You can use your own body weight. Therefore, you don't have to hold on to anything. You can grab some water bottles if you want to add a couple pounds, or grab some dumbbells, but only when you feel ready. Next exercise is spinal extensions. So sitting with arms at sides or on your lap, maintain a relaxed spine. Inhale as you sit up as tall and slow as possible, opening up that chest and that rib cage, and exhale as you relax the back and the chest. Repeat this about 10 times, a few times throughout the day. Shoulder circles. This is what we mentioned earlier in the presentation, but more specifically, we said shoulders up, back, and down. Gradually, you can just turn this into a smooth circular motion. So sitting comfortable in a chair with arms by your sides, lift ribs and relax spine into a neutral position. Slowly raise your shoulders up, back, and down. Keep circling your shoulders, repeating 10 times, breathing regularly in the nose and out the mouth. Our gaze is straight ahead. You can also do this with 1 pound weights in hands, and you can also reverse this motion and circle in the opposite direction. Here is an example of shoulders up, back, and down, or shoulder circles. Next, we have the shoulder blade squeeze. Pretty much exactly how it sounds. Standing or sitting with arms by your sides. Try to find a neutral spine position for your pelvis and mid-back. Bring your shoulders back, squeezing your shoulder blades together. Breathing in and out. Repeat 10 times. Make sure you don't arch your back too much when you bring your shoulder blades together. The next slide will show you an example. You can try this exercise if you'd like, standing in a doorway. One hand on each side of the door frame. All right, so the last exercise today that we'll be talking about are neck exercises. We can take our chin across the chest, side to side. We can drop our left ear to the left shoulder, our right ear to the right shoulder, look to the left and look to the right. Just keeping neck muscles loose will ease tension, which contributes to poor posture. In the next slide, you'll see some examples of these neck exercises. Below, you'll see a few neck exercises. I like to do these and suggest doing these exercises seated. Therefore, if you do get a little bit dizzy, you don't risk falling down. As you can see in the upper left, she's taking her gaze to the ceiling and dropping her chin to the chest. These exercises should be very slow and controlled. Over to the top right, as you can see, she's looking over her left shoulder and her right shoulder. And on the bottom, tilting the head side to side. Nice and easy. Hope you learned something about posture today. And if anything, I hope this presentation gave you a good reminder of how important it is to maintain good posture and to teach you a few tricks to to train yourself to maintain a good posture.